Welcome to the deep dive. Today, we're really plunging into one of the most fundamental parts of your body, and maybe one you haven't thought much about.
Possibly not, but it's incredibly impactful.
Exactly. The vagus nerve. As always, our mission is to give you that shortcut, to being really well informed. We've got insights, practical tips, all pulled straight from the sources we've looked at.
Yeah, let's unpack this amazing nerve.
Okay, let's do it.
It's truly like a central communication highway in your body. And what's so compelling, I think, is how understanding it connects the dots between things that seem totally unrelated.
Right.
It gives you profound insights into that mind-body link, that vital connection, and importantly, how you can actually influence your own health proactively.
That really does reframe how we think about health, doesn't it? So, okay, to start us off, what exactly is this vagus nerve we're talking about?
Well, technically, it's the longest of the cranial nerves, number 10 out of 12.
The 10th, okay.
And it literally wanders, that's the word they use, right from your brainstem, down through your neck, your chest, into your abdomen, all the way to your colon.
Wow, that's quite a journey.
It is. That's why it gets that nickname, the Wanderer. It's the main part of your parasympathetic nervous system.
That's the rest and digest one.
That's the one. It balances out the sympathetic system, the fight or flight response we hear so much about.
That's it.
And this nerve, it does two main things. It carries sensory info from your body to your brain, like sensations from the skin behind your ear, or maybe feedback from your stomach saying it's full. And it also sends motor commands from your brain back out, controlling things like your voice box, your lungs, definitely your heart, and crucially, that whole gastrointestinal tract.
Okay, and you mentioned the gut there. It feels like whenever we talk about the vagus nerve, it almost immediately leads us to the gut, this brain-gut axis that sounds incredibly complex.
It absolutely is. And, kind of surprising in some ways. Well, what's really striking is that the vast majority, we're talking like 80% to 90% of the vagus nerve's fibers are afferent.
Afferent, meaning going towards the brain.
Exactly.
Right.
Transmitting sensory information from the gut. Stuff like how your gut muscles are contracting, how fast food is moving through, signals about hunger or feeling full. All that intel is sent up to the brain.
So it's not just the brain telling the gut what to do.
Not at all. It's very much a two-way street. And this is super important when we look at things like functional gastrointestinal disorders, FGIDs.
Like IBS.
Like IBS, yeah, or functional dyspepsia. These aren't issues with the structure of the gut. They're problems with its function, how it moves, how it senses things. And guess what makes them worse?
Let me guess. Stress.
Bingo. Stress powerfully exacerbates them.
Which makes you think our modern lives, right? It feels like we're often in this state of like chronic hyperstimulation. Always on. Running in this sort of low-grade stress mode without even realizing it half the time.
Yeah.
So how does that constant pressure, how does it ripple through our bodies? What's the impact on health?
It's such a critical question. Because your nervous system, it doesn't really differentiate that well between, say, work stress and an actual physical threat.
Right. It just senses threat.
Pretty much. The vagus nerve sends that threat response signal up to the brain, and the brain sends signals back, gearing the body up for fight or flight.
Okay.
And here's something profound. Research shows chronic stress actually produces what scientists call the sickness response.
Sickness response, like being actually sick.
Exactly like being sick. Your body, through this nerve-brain communication loop, literally starts mimicking an infection. You get physiological changes, maybe a low-grade fever, inflammation, increased white blood cells.
Wow.
And even behavioral changes, like maybe you don't feel like eating as much or you just want to withdraw. One expert we looked at actually said, stress is another form of infection.
That's powerful.
It is. And this constant state can lead to things like increased stomach acid, inflammation in the linings of your arteries, which makes you more susceptible to really serious stuff like arterial sclerosis and even stroke.
That's a really striking image, isn't it? Stress acting like an infection makes you pause.
Yeah.
And it also brings up this idea of internal stagnation.
Stagnation, how do you mean?
Well, like a pond where things just sit and, get kind of gross. It seems to tie into vagus nerve function too, right? A sluggish digestive system, constipation, that can reflect poor vagal tone.
That's a good analogy. Things aren't flowing properly.
Exactly. And interestingly, our sources also mention physical interventions, like chiropractic adjustments, specifically focusing on the atlas bone.
Ah, the top vertebra in the neck.
Right. Apparently adjusting that can help reduce stress on the brainstem itself.
Which is where the vagus nerve originates.
Precisely. And doing that can actually stimulate the vagus nerve, help slow the heart rate, lower blood pressure. It's almost like hitting a sort of reset button for that fight or flight system.
That idea of a natural reset is really appealing. But what happens when those natural methods just aren't cutting it? Is there a more direct, medical way to stimulate that reset?
Yeah, that takes us into vagus nerve stimulation, or VNS, as an actual medical procedure.
Yeah.
Often it involves implanting a device, kind of like a pacemaker.
Okay, so this is more involved.
Definitely. It sends electric pulses to the nerve. Now, look, it can be truly life-changing for some people, but it's really important to talk at the safety side, too.
Sure. What are the potential downsides?
Well, side effects can include things like hoarseness, a frequent cough, sometimes breathing difficulties, even changes in heart rhythm. And in some cases, it could potentially aggravate depression or mania.
Okay.
And here's a really critical point. If you have an implanted VNS device, you cannot be treated with an AED, an automated external defibrillator, if you have a heart attack. That's vital info.
That is absolutely crucial to know.
But on the flip side, some patients who get VNS report huge improvements in their quality of life. They even say they regret not getting it sooner. So it's a complex balance for each person.
It really sounds like it. So who is this typically used for? What conditions?
The FDA has approved it for two main things. First, for certain types of epilepsy, it can help reduce or even prevent seizures by sort of calming down excess brain activity.
Okay, epilepsy. And the second? And second, for chronic or recurrent depression that hasn't responded well to other treatments, treatment-resistant depression.
Right.
The implanted device, as you said, it's similar to a pacemaker. There's an electrode gently wrapped around the vagus nerve, usually the right one, and a battery pack under the collarbone. It sends these regular little electrical impulses.
And does it work for depression?
Studies suggest that when it's used alongside routine treatment, VNS leads to higher response rates and better long-term outcomes compared to just the routine treatment alone.
Interesting. So, okay, we've covered the medical side, but what does this all mean for you listening? How can we take these ideas and use them day to day without needing a procedure? Let's get into the natural ways to stimulate this nerve.
Yeah, let's empower ourselves. And actually, a really powerful way, maybe one people don't think about much, is through sound.
Sound. Like music.
Well, more like activities that use the muscles at the back of your throat. Things like singing, chanting, even just having a really good hearty laugh.
Oh, okay. That makes sense.
Those actions directly activate the vagus nerve. Even simple things like gargling really vigorously or humming.
Humming, really?
Yeah. I actually remember reading about someone humming to their stressed cat, and apparently it calmed the cat right down. Maybe it works on humans, too.
Huh. Worth a try. And building on that, breathing?
That seems fundamental.
Absolutely paramount, especially for anxiety relief. We're talking diaphragmatic breathing, belly breathing.
All right, not shallow chest breathing. Exactly. Our sources mention specific techniques, too, like using a 1.4.2 ratio for inhale, hold, exhale, or ujjayi breathing from yoga, where you focus on the sound, that slight constriction at the back of the throat.
There's that throat connection again.
Yep, there's that saying, right? To control your breath is to control yourself.
Yeah.
And it's not just about calming down in the moment. Meditation, deliberate breath holds, they actually help develop your nervous system, your brain, especially that brainstem area where the vagus nerve hangs out.
So it's like strength training for your nervous system.
Oh, in a way, yeah. And physical activity in general plays a big role, too. Just regular exercise, moving your body. It increases fluids in your gut, improves motility.
Which stimulates the vagus nerve.
Precisely. And yoga specifically, with its mix of movement, meditation, and sometimes that oming chant.
The sound again.
Exactly. That's shown to really increase vagal activation.
Okay, this is interesting. Another one that surprised me was cold exposure.
Ah, yes, the cold plunge.
Or maybe just a cold shower, thankfully.
Yeah.
Or splashing ice-cold water on your face. How did that work?
It seems to act as a kind of shock to the system, but in a good way. It triggers the vagus nerve and helps quickly shift your body out of that fight-or-flight mode and into rest and digest. Almost like an instant reset.
Fascinating. Okay, what else? The sources mentioned quite a few other things.
Yeah, it's quite diverse. Positive social connections, believe it or not. Studies on compassion actually show improved vagal tone.
Really? Just being kind.
Seems that way. Also, probiotics, specifically a strain called Lactobacillus rhamnosus, good for the gut, good for the vagus nerve.
Makes sense, given the gut connection.
Getting some direct sunlight helps too. It increases a hormone called MSH, which stimulates the vagus nerve. Then there's incorporating things like prayer, traditional acupuncture, especially points on the ear.
The ear. Why the ear?
The vagus nerve actually has a small sensory branch that innervates part of the ear.
No way. Okay.
Also things like PEMF therapy, pulsed electromagnetic field therapy, and even just gently massaging certain stress points in the front of your neck can help.
Wow, it's incredible how far this wanderer nerve really reaches.
Yeah.
When you start looking at specific health conditions, like you said, the connections are everywhere.
Almost everywhere, yeah.
Let's touch on a few more that stood out, like diabetic autonomic neuropathy. Go man.
Right. That affects the autonomic nerves in people with diabetes.
And the symptoms, things like lightheadedness, maybe angina, shortness of breath, that dizziness when you stand up too fast.
Postural hypotension, yeah.
It helps explain why someone with DAN might really struggle with standard exercise advice, doesn't it? Because that high, unstable blood sugar damages the nerves, including the vagus, potentially making pain worse.
It's a really difficult complication. And then there are hiccups.
Hiccups, just annoying, right?
Usually just annoying, yeah. But what's fascinating is that they're often caused by irritation of the vagus nerve or one of its branches. And all those weird remedies, people try holding your breath, eating sugar off the back of your tongue, getting startled.
Putting fingers in your ears, pulling your tongue.
Right. They all seem to work by essentially overwhelming or distracting the nerve signal, resetting that faulty reflex.
Okay, that makes sense now. How about infantile colic? That's a tough one for parents.
Oh, incredibly tough. You see babies with just incessant crying, tight stomach muscles, trouble feeding, gas, reflux, constipation. They just can't self-soothe.
And the impact on parents is huge.
Absolutely overwhelming. The sources talked about parents pushed to the brink, experiencing depression, anxiety themselves. It's rough.
Are there things that help?
Well, natural remedies are often tried. Probiotics, digestive enzymes for the baby, maybe mom adjusting her diet if she's nursing, cutting out dairy, gluten, garlic, spicy foods, Epsom salt baths for the baby, frequent burping.
Standard stuff?
Yeah, but pediatric chiropractic care was often highlighted as potentially the most effective. The idea is gently addressing any possible nerve irritations stemming from the birth process or alignment issues.
Interesting. Okay, shifting gears. Parkinson's disease.
Yeah.
We usually think of the tremors, the movement issues.
Right, the motor symptoms. But what's often missed, and can show up years earlier, are the non-motor symptoms.
Such as?
Things like losing your sense of smell, sleep problems, constipation. There's the gut, again, a soft or low voice, dizziness or fainting, fatigue, sleeping too much during the day, even new depression or anxiety.
Years before the movement problem.
Sometimes years, yeah. It relates back to those Lewy bodies, the protein clumps and dopamine depletion in the brain. And that sleep issue you mentioned, it's often quite specific. Falling asleep okay, but then waking up suddenly, maybe feeling panicked like 1 to 3 hours later, that points to nervous system dysregulation.
Man. Okay, what about referred pain?
This is a fascinating one. Pain isn't always where the problem is, right?
Right, like shoulder pain from a gallbladder issue or something?
Right. Exactly. It happens when a nerve gets compressed or irritated somewhere along its path, maybe from a muscle spasm, a disc problem, arthritis, even a tumor. The pain signal gets misinterpreted by the brain as coming from somewhere else that nerve supplies.
So you feel weakness, tingling, maybe pulsing pain in a totally different spot.
Yep. And conditions like diabetes can make it worse because the nerves might already be damaged. Really highlights why good posture is important and why you need to get persistent pain checked out properly.
Definitely. Let's talk about weight loss. How does the vagus nerve fit in there? Seems less obvious.
Well, thinking outside the box here often means looking at basic cell processes, like how cells manage energy phosphorylation signaling pathways.
Okay, getting technical.
A little, but sources mention supplements that can support fat burning through these pathways, things like Altir, leucine, isoleucine, creatine. But the vagus nerve connection comes back partly through breathing.
Breathing again.
Deep breathing activates the vagus nerve, which can help improve oxygen flow and efficiency, and maybe even give you more conscious control over gut signals related to hunger and fullness. It's part of the bigger metabolic picture.
I see.
Okay.
How about smoking? We know it's bad for the lungs, obviously.
Right. But the sources pointed out it also directly irritates the vagus nerve by increasing stomach acid.
Affecting digestion.
Exactly. And surprisingly, one angle mentioned was that chiropractic treatment, by maybe reducing overall nervous system stress, could potentially help reduce cravings for some people.
Huh. Interesting link.
Yeah.
And finally, let's circle back to depression and anxiety. We mentioned VNS as a treatment for resistant cases.
Right, the implanted device.
But the sources really hammered home the importance of lifestyle, didn't they?
Absolutely. Regular exercise, even just walking, it's a natural mood booster. Healthy diet, good sleep hygiene, finding ways to cope with emotions, having strong social support, trying to cultivate a positive mindset. All these things are vital.
They really are. And it touches on the stigma, too.
Definitely. There was a really poignant comment in one source. Someone who had had a heart attack said they would genuinely choose another heart attack over suffering major depression and anxiety again.
Wow.
But
That really says something about the level of suffering.
it really does. It highlights the profound, often invisible pain and just how critical comprehensive support is. It's not just in your head.
Not at all. That
Yeah.
puts it all into perspective. So as we wrap up this deep dive, it's so clear the vagus nerve is this incredible, far-reaching part of us,
Truly fundamental.
connecting our mental, emotional, physical states in ways we probably don't even realize most of the time. It really drives home how interconnected everything is.
Yeah, seemingly separate symptoms might trace back to this one wandering nerve.
And I think the real breakthrough for me anyway is seeing how understanding this nerve gives you a different lens, a way to look at your own health, your resilience.
And proactively manage it. That's the empowering part, isn't it? These insights give you actual tools, practical things you can do.
Absolutely.
Yeah.
So we really encourage you, everyone listening, to reflect on this. Maybe think about incorporating some of those natural techniques, the breathing, the humming, maybe even a cold splash of water.
Yeah, try them out. And of course, always talk to your healthcare professionals for advice tailored to you.
Definitely. So maybe the final thought to leave you with is this. As you go about your day, maybe just consider, how might actively nurturing this wanderer nerve, this vagus nerve, how might that reshape your approach to your own well-being, your resilience, especially in this pretty demanding world we live in?
Something to think about.